The Kyshtym Disaster. In 1957, an event occurred that would shatter the facade of secrecy surrounding the Soviet Union's nuclear endeavors, and its repercussions would reverberate for decades to come. At the heart of the Kyshtym disaster was the Mayak Production Association, a sprawling complex located in the town of Ozyorsk, approximately 90 kilometers east of the city of Chelyabinsk in Russia. The facility was a clandestine hub for Soviet nuclear activities, including plutonium production for nuclear weapons. On September 29, 1957, an explosion rocked Mayak's plutonium production plant. The explosion occurred in a waste storage facility known as Tank 54, which held highly radioactive and chemically reactive waste. The resulting blast released an immense amount of radioactive particles into the atmosphere. The exact circumstances that led to the explosion were a subject of conjecture, but it was widely believed that a chemical reaction in the overheated waste storage tank triggered the catastrophic event. One of the most sinister aspects of the Kyshtym disaster was the government's initial efforts to conceal the extent of the incident. Despite the scale of the explosion and the resulting contamination, Soviet authorities remained tight-lipped about the disaster. They downplayed the incident and released limited information. The Kyshtym disaster's impact on human lives and the environment was profound. The release of radioactive particles had devastating health consequences for those exposed to the fallout. The initial explosion claimed several lives, and those who survived faced the invisible menace of radiation exposure. Acute radiation sickness, cancers, birth defects, and other health issues plagued the affected population for years to come.
The Sverdlovsk anthrax outbreak. Sverdlovsk, now known as Yekaterinburg, stood as a vital industrial and cultural hub within the vast expanse of the Soviet Union. Yet beneath its bustling exterior lay a well-kept secret, a biological weapons research facility known as Compound 19. This facility, operating under the shroud of Soviet opacity, was engaged in the development of biological agents for potential warfare, including the notorious anthrax bacterium. The nightmare began to unfurl on a seemingly ordinary day in April 1979. Residents of Sverdlovsk went about their lives, unaware of the invisible threat that had been released into the air they breathed. A plume of deadly anthrax spores borne by the wind infiltrated the city, silently insinuating itself into the lives of those it would soon claim. As the days passed, individuals began to fall ill, gripped by a mysterious illness characterized by flu-like symptoms, respiratory distress, and skin lesions. Panic spread through the city, with authorities struggling to comprehend the scale of the crisis. In a bid to control the narrative, Soviet officials disseminated a narrative that attributed the outbreak to contaminated meat. This official explanation, however, crumbled when patterns of infection defied the meat-based explanation, and the undeniable link between the outbreak and Compound 19's research became increasingly difficult to ignore. The evidence pointed unequivocally to the release of anthrax spores from Compound 19. With the truth revealed, the Soviet government was forced to acknowledge the reality of the outbreak. However, the extent of the damage had already been done. The outbreak had claimed the lives of at least 66 individuals, inflicting immeasurable pain on their families and leaving a scar on the city's history.
The Tokaimura nuclear accident. In 1999, the Japanese town of Tokai was rocked by a nuclear disaster that originated in a fuel reprocessing facility. On September 30, 1999, the plant's workers began their routine tasks, unaware of the impending disaster that would redefine their lives and the course of nuclear energy. The process involved the production of enriched uranium, an essential component of nuclear fuel. However, in this instance, a deviation from protocol catalyzed a chain reaction that would spiral into catastrophe. As workers mixed a solution of uranium in a precipitation tank, they inadvertently surpassed the critical mass required for a sustained nuclear reaction, a process known as criticality. Within the confines of the tank, an invisible enemy emerged, releasing an intense burst of radiation that engulfed the facility and its surroundings. In the wake of the accident, chaos ensued. Alarms blared, signaling the release of radiation. The facility's workers scrambled to contain the situation, battling an adversary they could neither see nor fully comprehend. Containing the radiation proved an arduous task, as the invisible menace continued to emit its deadly payload. In the midst of the chaos, workers and responders faced grave risks, willingly sacrificing their own safety in a desperate bid to mitigate the disaster. Containing the radiation proved an arduous task, as the invisible menace continued to emit its deadly payload. In the midst of the chaos, workers and responders faced grave risks, willingly sacrificing their own safety in a desperate bid to mitigate the disaster.
The aftermath of the Tokimura accident was a haunting tableau of human suffering and the unforeseen consequences of scientific exploration. Marburg virus outbreak. In August 1967, Marburg was thrust into the international spotlight as individuals in the town began experiencing a series of alarming symptoms. Muscle pain, headaches, malaise, and rapidly escalating body temperatures marked the initial stages of the illness. Medical authorities were perplexed, as these symptoms were not associated with any known disease at the time. The afflicted individuals were initially isolated in their homes, a desperate attempt to contain the potential spread of this mysterious ailment. However, as the symptoms grew more severe, those infected were transferred to university hospitals in Marburg and Frankfurt for intensive monitoring and treatment. As the outbreak continued, a terrifying progression emerged. The infected individuals began experiencing fever and bleeding from various bodily orifices, indicating a severe hemorrhagic shock. The breakthrough in understanding the virus's nature came in an unexpected manner. A pathology technician accidentally contracted the virus during a post-mortem examination, where he cut himself. This unfortunate incident revealed that the virus could be transmitted through blood exposure, offering a crucial clue for epidemiologists. The investigative trail then led to a common link among the affected individuals: contact with blood and organs of African green monkeys. Once the source and method of transmission were identified, containment efforts intensified. The virus was finally brought under control, but not before it left a mark of devastation. The Marburg virus outbreak of 1967 recorded 32 confirmed cases and 7 deaths.
The Ebola Lab Leak. The story begins at the Institute of Tropical Medicine in Antwerp, Belgium. The institute was renowned for its research on infectious diseases, including the Ebola virus. Researchers there were working with various strains of Ebola to better understand the virus's behavior and develop potential treatments. In a fateful turn of events, a researcher accidentally pricked her finger with a needle while handling a syringe containing a strain of the Ebola virus. This seemingly minor mishap would set off a chain of events that would test the limits of containment protocols and reveal the potential risks associated with working with dangerous pathogens. Following the accidental needle stick, the researcher experienced symptoms consistent with an Ebola infection, including fever, fatigue, and muscle pain. Recognizing the gravity of the situation, medical authorities and researchers swiftly initiated isolation protocols to prevent the potential spread of the virus. As the researcher's condition deteriorated, it became clear that she had indeed contracted the Ebola virus. What followed was a race against time to contain the outbreak within the confines of the research institute. Extensive contact tracing and isolation measures were implemented to prevent the virus from escaping into the broader population. The containment efforts were ultimately successful, and the outbreak was confined to a limited number of cases within the research institute. The Ebola Lab Leak incident led to increased scrutiny of the protocols and procedures in place for working with dangerous pathogens.